An alert for a rare and potentially deadly disease. Health officials say a food handler at Purdue has typhoid fever. Now, anybody eating at several on-campus dining areas over a 3-day period could be at risk. News 18's Brittany Tyner is live on Purdue's campus, where university officials are urging diners to be on the lookout for symptoms of typhoid. Brittany, what should they be looking for?
Dan, symptoms of typhoid fever include that high fever, stomach pains, nausea, vomiting, diarrhea, and maybe even a rash. And these symptoms may not even begin until 8 to 14 days after exposure. Now, typhoid fever may not be that well known of an illness, but if not treated, it's an illness that could be fatal.
First, I was kind of thrown back. I've never heard of that even before.
What's that?
I know that typhoid fever makes you really sick, but I wasn't quite sure about the different symptoms.
Although some Purdue students may not know what typhoid fever is, they may be at risk. State health officials announced Tuesday that a food handler at Marriott Hall is positive for typhoid fever. The patient contracted the disease while traveling internationally. Now, anyone who ate at Boiler Bistro, the John Purdue Room, or Lavazza Coffee Shop from January 23rd to January 25th should be on the lookout. The illness, caused by bacteria in the Salmonella family, can put people at risk if they eat food or drink beverages that have been handled by someone with the illness.
What happens is you consume the organism, which is a Salmonella organism, and then you begin to start having usually low-grade fevers over the course of a week. The fever starts progressively getting higher.
Stomach pains, vomiting, diarrhea, and in some cases a rose-colored rash can accompany the fever, and they may not begin until 8 to 14 days after exposure. In other words, symptoms for some people may not have appeared even now. On average, only 3 cases of typhoid fever are reported annually in Indiana. By state law, typhoid fever must be reported.
Physicians that diagnose these cases are required to report them immediately to the local health department and to public health. And that's how this case was discovered, that the individual had sought medical treatment, the doctor diagnosed it, tested, and turned out to be a case.
Healthcare providers say the best way to protect yourself: wash those hands.
Let's say somebody goes to the bathroom, doesn't wash their hands. You come, they shake your hands, and then you grab your hamburger, take a bite of it. And basically, you can be consuming some of the organisms that they had on their hands.
Still, some Purdue students say the whole situation is a little scary.
I don't know where I would eat because I'm on a meal plan and I have no money.
Typhoid fever can be treated with antibiotics, and people on antibiotics usually feel better within 2 to 3 days. However, if the illness is left untreated, typhoid fever could be fatal. Purdue officials say the infected food handler will not return to work until cleared by the state health department. Again, if you ate at Marriott Hall on those days in January and are experiencing some of these symptoms, please see your physician. Reporting live in West Lafayette, Brittany Tyner, News 18.